Fibromyalgia is a complex syndrome characterized by pain, musculoskeletal discomfort, and multiple systemic symptoms. In order to meet the criteria established by the American College of Rheumatology, the pain must have been present for at least 3 months, and it must occur in all 4 quadrants of the body. Fibromyalgia affects millions of people worldwide, of whom approximately 90% are female. It can occur in any age, but is most common in the 35 to 55 age range. Robert Olin, MD, has studied 1,500 patients with fibromyalgia. Here's a list of the most common systemic symptoms that he documented. Generalized pain, fatigue even upon awakening, stiffness, sleep disturbances, both musculoskeletal and/or migraine headaches, numbness, tingling, and dizziness, the inability to think clearly, sometimes referred to as fibrofog, severe menstrual pain, an irregular heart rhythm, irritable bowel syndrome, temporomandibular or TMJ syndrome, restless leg syndrome, interstitial cystitis or irritable bladder, and anxiety and depression. There are particular tender points when pressure is applied, as demonstrated on the screen. Traditionally, 11 of these 18 points must be positive for the diagnosis of fibromyalgia. There is no commonly accepted laboratory test or other study that is conclusive for the diagnosis of fibromyalgia. However, research has indicated that there are 2 uncommonly performed tests which are very suggestive of fibromyalgia. Natural killer cells are frontline immune system cells which are active in seeking out viruses, intracellular bacteria, and tumor cells. Their activity can be measured, and if that activity level is below what is minimally accepted as normal, a state of immune system dysfunction exists. Typically, fibromyalgia patients have natural killer cell activity which is below normal. Magnesium is a critical mineral needed for over 300 bodily enzymatic reactions. 99% of magnesium is found in muscle and bone. 1% is in the liquid part of the blood called the serum. To maintain a normal serum magnesium level, magnesium leaks from the muscle and bone into the serum. The usual test for magnesium will test only the serum level, which will typically be normal. A total body magnesium level is often low in fibromyalgia and can and should be checked by measuring magnesium inside of red blood cells. There are many nutritional supplements that have proven to be beneficial in fibromyalgia. Restoration of immune system function is vital in the healing process of chronic diseases. Transfer factors, when augmented with other immune system stimulants, have been shown to increase natural killer cell activity both in vitro or in a test tube analysis, as well as in vivo testing, which has been conducted in actual fibromyalgia patients. High-dose magnesium supplementation restores low total body magnesium and is absolutely essential. The unrelenting fatigue of fibromyalgia can be lessened and eventually eliminated in many affected persons by the use of malic acid, which enters into and promotes the energy production within our cells. Glucosamine and bovine cartilage, or chondroitin sulfate, support the musculoskeletal structural system, which is the site of the pain of fibromyalgia. Chronic illnesses such as fibromyalgia result in excessive cellular damage from free radicals, and this cellular damage places even more stress on the already dysfunctional immune system. Powerful antioxidants such as alpha-lipoic acid, N-acetylcysteine, and L-cysteine prevent or minimize free radical damage. Methylsulfonic methane, or MSM, and Boswellia serrata, bromelain, and devil's claw are excellent anti-inflammatories which help with the pain of fibromyalgia. Fibromyalgics have sleep disturbances. It is impossible for the body to heal if deep therapeutic sleep isn't obtained. Here you see how fibromyalgia affects sleep patterns by interrupting deep delta wave sleep with light alpha wave sleep. Restoration of the therapeutic sleep is critical. Combination natural products such as melatonin, kava, valerian, and 5-hydroxytryptophan can be beneficial in restoring therapeutic sleep. A fibromyalgia sufferer should also incorporate the essential fatty acids into their daily regimen, especially the omega-3 fatty acids, which are necessary for cellular repair. And lastly, a complete vitamin and mineral supplement should be incorporated so that the body will have all of the essential nutrients to allow itself to heal. A person diagnosed with fibromyalgia should also purchase a book on helpful dietary modifications which can help speed the healing process. A wise man once wrote that given enough time and nutritional support, the body has the ability to heal itself from many chronic illnesses. Certainly, this is true for the millions of people who suffer from fibromyalgia.